You had some electrostimulation you were doing earlier on.
Yes, in terms of, you were asking briefly or saying was to talk about vagal nerve stimulation.
Yes, yeah.
And this is something that I find very helpful. Again, if you have maybe chronic pain or perhaps the migraines. So when we activate the vagal nerve, we're doing quite a lot of different things. There's the parasympathetic activity, reducing like heart rate and making the breathing longer and more regular. There's the potential to increase sort of stomach acid and all the release of the digestive enzymes and other gastric juices, increase the motility, because that's all going down, vagus beginning to work on those. And they're also finding now that, I forget the exact cells, but some of the cells in the gut, when you activate the vagus nerve, then decrease the amount of inflammatory releases, so you can lower inflammation in the gut. When you lower inflammation in the gut, you've then got the potential to in the brain as well, because the cytokines will travel from one to the other. So it can be very useful downwards for decreasing inflammation and getting the parasympathetics working better. And the studies now showing that almost everyone, when they have a head injury, within 2 or 3 days, gut function is altering. So they may not feel it, but it's been measurable.
Right.
Which is, again, really interesting and sort of says, well, we want to get these areas working again. So I'll test by looking at the palate and the sensitivity, get the patient to go, ah, and then look at the back of the palate, which side are both lifting up well, or is one side not lifting up so much? And usually the side that isn't lifting up so much might be more sensitive, and when I do the gag, they might feel it more, or it might make them gag more. So
we won't do that.
No.